the drone aspect of it is part of that puzzle, but delivering better healthcare is really what's kind of critical. And so being part of it is really exciting. And the new technology that you said, there's a huge number of drone companies that have the technology that can help support this and make it a reality.
You're listening to the Drone Radio Show podcast, the show about drones and the people who use them for business, fun, and research. Hosted by Randy Goers.
Hello, everyone. This is Randy Goers, and welcome to the Drone Radio Show podcast, episode 415. Did you know that drones are being used to transport medical payloads? To find out more, we head to London to speak with Louisa Smith, Chief Aviation Officer at Apian. Apian is a healthcare logistics company founded by a team of National Health Service doctors in the United Kingdom. The Apian platform integrates both healthcare and aviation systems, creating a fully autonomous, on-demand delivery system that improves patient health outcomes and staff well-being. In the long term, the service could allow healthcare providers to reduce the number of canceled procedures and thus decrease wait times. Before joining Apian, Louisa was the head of research and development at the National Air Traffic Service and a former military air traffic controller. She is now bringing her aviation knowledge and experience to healthcare. In this edition of the Drone Radio Show, Louisa talks about the efforts of Apian to develop drone delivery services for the National Health Service in the United Kingdom. But before we hear from Louisa, I want to stress that your support is the heartbeat of my podcast. Every episode is crafted with you in mind, and your generous donations ensure I can keep delivering the content you love. Whether it's the price of a coffee or a more substantial contribution, every bit helps to defray the cost of production. Donate today and be a vital part of the podcast's continued journey to greatness. And for a limited time, donate $100 or more and receive an official Drone Radio Show coffee mug. To donate, go to droneradioshow.com/donate. And if you can, please subscribe to the podcast on your favorite platform and leave a nice review and rating on iTunes. It really helps improve the podcast ranking among the many thousands of active podcasts today. So let's find out how drones are being used to transport medical payloads in the United Kingdom. Let's pick up the interview where I asked Louisa to introduce herself.
My name's Louisa Smith. I'm Chief Aviation Officer at Apian, which is a medical drone logistics company in the UK.
Louisa, tell us about Apian.
Yeah, so Apian is, as I said, a medical drone logistics company. It was co-founded by NHS doctors in the UK, where they were working in the NHS and kind of finding a frustration around how quickly and how efficient some of the requirements they are to get some of the logistics sorted. It was frustrating for them that patients could get pizza delivered to the bedsides quicker than they can get some medical treatments, etc., to them, or testings of pathology, for example, and things like that. So they got very frustrated with that, and so looked at whether the drone delivery could bring benefit to the NHS and the healthcare industry. We aren't a drone operator. We are drone operator agnostic, so we work with lots of different drone operators. And our concern is around the integration into the healthcare industry so that doctor or clinician can order some bloods or pathology or medical devices and just use a very simplistic system to connect to the drone operators.
How old is the organization?
Apian was founded in 2020.
Is it a private company or a public agency?
Yes, it's a private company. We work with the NHS, but we are privately funded.
Tell us more about the National Health Service.
So essentially, it's a government organisation where everyone can receive treatment. That could be from your GP, dentist, to hospitals and other such like those like physio and things like that. So the NHS is something that we hold very close to our hearts in the UK. And obviously, a lot of our family and friends all work in the NHS. So it's kind of a real national infrastructure that is really significant. And how we work and operate with them, the NHS is compiled of over 250 trusts across the whole of the UK. And so how we work is to make sure that their life is easier, that we can integrate within the drone operators, and they would just order something just like they do now via Uber or taxi or something like that if they needed it. But we would essentially just make all that kind of integration, take that off their hands and take off the drone operator's hands as well. So the drone operator can just focus on actually delivering the load that they need to.
What type of items are typically delivered by the drones?
We're still very much in trial phases in the UK. So we've done a number of trials, and that's based on some of the challenges around the regulations that we are exposed to in the UK with the aviation regulations as well as the healthcare regulations. And so we're working with our partners to look at what products can be delivered and what is providing benefits. But essentially, so far, Apian has conducted the first chemotherapy flight in the UK, as well as delivered the first prescription medicine with Boots as well in the UK. So there are a wide variety of different medical equipment that we'd be looking to utilise. But at the moment, we're currently looking at pathology, chemotherapy and things like that. But actually medical devices and there's like no end of use cases of what we could deliver. Some of it is limited down to the payload actually of the drone. So some drones can only operate or deliver 1, 2, 3 kilos, and some obviously can deliver some additional ones. For example, if you're delivering something like chemotherapy, there is certain equipment that needs to be kept at a set temperature, etc. So there's other kind of storage and what it's delivered in is essential as well. So sometimes the medical payload might be quite lightweight, but actually the packaging that's required might add additional elements to that.
Is the service used in both rural and urban areas?
Yeah, definitely. I think it's both relevant for rural and urban. There's quite a lot in the UK going on with ourselves and other projects and other organisations around rural. Some of the trusts that we work with, for example, Northumbria, NHS Foundation Trust that Apian are partnered with, they operate quite a large area. And some people are maybe an hour's drive away from a hospital or a little bit further than that. And so they might need to travel significant distances to get certain healthcare because not all services are provided from each hospital. So from a rural aspect, there's quite a large area that could benefit from drone delivery. And it can help with things like centralisation of stock. And so that all hospitals or doctors' surgeries don't need to hold all medical equipment that they need. And so it could be more centralised and then just kind of distributed when required. But also in the urban areas, there are congestion, there is a need for sustainability in the future. And actually, looking at our large cities like London, it can actually take a significant amount of time to get something only moved a couple of kilometres. So actually drone delivery in urban environments, I think, is important as well.
In terms of the operation, I've heard comparisons to Uber Eats. Can you elaborate?
Yeah, so I think we make that comparison quite often. That's similar to something like Uber in a sense of the taxi driver is, you request of Uber that you have a taxi driver, and actually Uber deals with the taxi driver, and that interface with the taxi driver is something different for them as well. So in that sense, the drone operator needs to know where they need to pick up a delivery and where they need to deliver it to. But equally, the clinician or the doctor needs to be able to order very specific information about what they want, where they need it, and whether there's any other requirements around it. So it's more around that aspects of it, that there's kind of different interfaces to different people, but actually it's around the logistics. That's kind of why we make the reference sometimes.
How do you decide when to use a drone for the delivery?
So essentially, we're not saying that drones are the answer to everything. There will still be a need for, traditional van or by road, I should say, sorry. There's still going to be a requirement for some of those deliveries. And this is around enhancing the current logistics that we have for the healthcare system. But yeah, essentially the Apian platforms will ensure that the quickest and most efficient way, as well as sustainability way, is taken into account, because it might not be a drone. And so therefore it's not around flying drones just for the sake of flying drones. This is really around delivering a better healthcare system and for us all as patients to be able to receive better healthcare.
And ideally, the end user probably doesn't really care how the product arrives, just that it does arrive as quickly as possible, right?
Yeah, so essentially it would be great for, in 20 years' time where people just are really not worried about whether it's been by a drone, and it's just commonplace that a drone has delivered it, and actually it's not quite the excitement that we've all got at the moment around seeing drones fly and delivering stuff. And I think it will just be commonplace. And so, yeah, definitely expecting kind of a delivery to just be taking place without people being aware.
What are some of the challenges in designing a drone delivery service for the NHS?
There's a couple of kind of main challenges, which I think aren't necessarily unique to the UK. They're kind of very global challenges at the moment. One is around the public perception. So definitely around, a lot of people are aware of drones in a negative sense, or for military support or for war, which sometimes has really negative connotations. And so ensuring that people really understand that these drones can deliver good and they can provide benefits and help our kind of ecosystems that we have is really critical. And that will help with getting public acceptance of it and allowing us to be able to operate in more kind of areas where the people might see them more commonly around. So definitely the public perception is one. Another one is kind of regulations in a sense of airspace integration. So again, not necessarily something that's unique to the UK, but we have different operators in the airspace. We have different classifications of airspace. People can operate it for general aviation, or whether you've got a helimed, and how we integrate safely into that airspace to ensure that we can still assist and allow helimeds, for example, or the police or the military to gain access to airspace, and we're not blocking those off, is challenging in a sense because of the regulation and the development of the regulation and where it currently is. The ambitions for the UK are that we have full integration and that we don't have segregated airspace restricting people's movements. But at the moment, for us to be able to prove some of the elements that we need to, we are required to have segregated airspace. So ensuring people understand that journey that we're on and that this is not a long-term solution can be something that we kind of constantly have engagement with and speaking to different people in the community, in the aviation community as well. And then also on the kind of regulation side as well, as around the platforms that are used, drone operators and technology is advancing so quickly. Aviation traditionally is quite a slow regulatory movement. For aircraft to be certified and to be manufactured can take a significant amount of years. And actually, we're talking about technology that can be outdated in a year or two. So it's real, helping and assisting the industry to work with regulations. And it's like a chicken and egg thing where actually we need to prove some of the safety cases to ensure that we've got safe operations to allow the regulations to be developed. What
has been the view or the feedback from the regulatory authorities in England?
I think that they're generally excited about it. The Civil Aviation Authority, who's our aviation regulators, much like the FAA, are excited, but essentially their role is to make sure that we're working safely. That's what they're there to do. That's their job of the regulator. So ensuring that we can do all of that and make sure that we're doing it safe is important. But the CAA has taken huge steps over the last few years to work out how we can develop this and get to that airspace integration. They've announced kind of sandbox projects, they call them, which allows us to test some of the regulation theories and making sure that we're adhering to all safety aspects, but allowing us some kind of ways to challenge what we're doing and look at new ways of doing it. And some of our projects in Apian are in that environment as well. So they're doing exactly what we need them to do, which is helping some of this develop. But again, it's down to industry to prove that we can do this safely, which is really critical.
So what's the current status of medical drone deliveries? I understand there was a recent demonstration project in Northern England.
So I think you're referring to one of our projects, mainly in the Northumbria region, where we conducted some trials last year. Real success, where we did over 200 flights in 3 months, gathering data. And actually one of the things that we did there was delivering pathology via road and via the drone, and then being able to test the products at the end. All the participants were fully aware of their blood samples being delivered via drone, so don't worry about that, but they're all very willing participants. But there's a lot of regulation on the healthcare side as well. So we very much work with the trust and making sure we've got the right approvals to be able to deliver and making sure that they're getting the assurance that they need, that the products are maintaining their expectations as they do the flights, as they would do via road. So at the moment, we're looking at our next phase, which is more of a hub and spoke model. We're looking at kind of a lot more flights and a lot more capacity. And again, this initial stage will be for 6 months of operations. We've just been out to stakeholders, for aviation stakeholders, where we've got a huge amount of feedback from them all, which is really helpful because that helps us design the airspace, look at some of the challenges that they've put forward, and then redefine our operations. So, for example, we've reduced our operating hours and we've reduced the area of impact of the airspace that we're looking at. And we're just in that phase at the moment where we're collecting all the information before we submit our formal request for airspace change to the Civil Aviation Authority. And our drone operator is applying for their operational authorization as well, which is a requirement for us to be able to operate. So we're just in that phase as well. And we continue to work with the NHS to look at use cases that might be appropriate for the project, but also how we're capturing those benefits for them and making sure that they get what they need out of the trial as well.
I know it's early and there's still a lot of work to be done, but how do you see the next few years evolving for medical drone delivery in England and the role that Apian will play in that process?
I think over the next few years, we'll see a huge more uptake of medical drone deliveries in the UK. I think some of the benefits that we can showcase through our trials are really critical to the healthcare system, but also it really impacts the patient and clinician. So for me, I would really like us to be able to showcase the benefits and for people to see the benefits almost firsthand as a patient's being provided. And some of that looks like them not waiting around in hospitals because they're waiting for test results. And some of that looks like opening up new treatments closer to their homes so they don't have to travel so far so that they can receive the healthcare that they want. So for me, I really want the patients and clinicians to start seeing the benefits, but I do think there'll be a huge uptake around a significant more increase of numbers of medical deliveries. And I think because it's the NHS as well and medical drones, that impacts everyone in the UK because everyone receives treatment from them. So it's a national infrastructure, which is really significant and important for us as the UK.
What are you learning from efforts in other countries?
There's a huge amount of work going on globally around this work as well. So it's really interesting for me. I do follow what's going on in the States, in Australia, in Europe, in Germany and Ireland and things like that. And that's really significant as well because actually we're seeing similar countries that have similar airspace structures as ourselves that are really kind of showcasing the benefits of some of this as well. So that's significant. And I think it's important to look at what is going on globally as well. I mean, there's huge benefits on the healthcare side in Africa as well. The structure and the airspace side is slightly different than it is over here. But again, like showcasing the benefits that people can receive from drone delivery is really important. And ensuring that message of drone delivery is good is really helpful.
How does it feel for you to be spearheading this new technology in the field of healthcare?
I think it's really exciting, right? Like I really want to, in 10 years' time for me to be able to say I was a part of this medical delivery service that now helps and is just part of our common kind of way of delivering logistics. So for me, it's really exciting. It's something that I really feel close to our heart. Like it is real to help people, to make them not have to sit around and wait for stuff, or to help kind of save money for the NHS as well without, centralization of stocks, etc., like that. So that we're actually having a real impact on people and their lives is what excites me about what we're doing. Probably not necessarily something that I should say, but the drone aspect of it is part of that puzzle. But delivering better healthcare is really what's kind of critical for me. And so being part of it is really exciting. And the new technology that you said, there's a huge number of new drone, not necessarily new, but drone companies that have the technology that can help support this and make it a reality.
Is there anything that we missed that we should talk about?
There's a couple of use cases which can really showcase the benefits that this can provide. And I think there's a few examples in the UK which anyone can understand. There's an island called the Isle of Wight, which is just off the coast, on the south coast of England. It takes 10 minutes on a hovercraft to get there, or 20 minutes on a boat. And they've got, the population over there is quite a large area, and they have a hospital over there. And that's one of the ones we first worked with on looking at chemotherapy and the benefits of delivering chemotherapy. And essentially, product is made on the mainland and then transported over to the Isle of Wight for patients. And sometimes people might need their bloods checked, or the chemotherapy might need to be made before it's transported. And so either that might get there and they unfortunately can't have their treatment because their tests haven't come back appropriate levels, and therefore that chemotherapy gets wasted. or they might not be able to have the treatment there, and they might have to come to the mainland, which obviously means that they have to travel a significant amount of time to get here. And I was explaining to one of my husband's friends who he plays rugby. I appreciate that's not necessarily a big sport in the States, but plays rugby. And I was talking to him about what I did as a job, and he was aware of the trials. And he said that his father lived on the Isle of Wight, that unfortunately his dad actually passed away from cancer the year before. And I was talking to him about what we were doing, and he just said to me, oh my God, if we had had that in that year that my dad was having treatment, we could have spent so much more time with him. And that is really kind of why we're doing it. Yes, I know drones are super exciting. We like the technology, but it's really about making people, their lives different and have a different aspect of it, so they don't have to do all that type of stuff waiting around. They can have treatment at home or closer to home. So it really opens that, and that's what, for me, is why we're doing it.
And for my final question, Louisa, what message would you like to leave regarding the future of the drone industry?
When I talk to people about it, I think it's good to just ask them, like, do you think drones are going to be in our future? Like, can you imagine drones delivering medical goods in the future? And most people will say yes. And so I think for me, it's around drones are good. They can deliver better logistics for us, and they are going to improve our lives, and it is coming. So I think that's the message I would like, which is this is a really exciting time for us. In 20 years' time, it will just be part of our normal system, and we probably won't even recall some of these conversations that we've had. So I think for me, just getting people to understand that drones are going to deliver good for us in the future.
That's it for episode 415 of the Drone Radio Show. I hope you enjoyed hearing from Louisa Smith of Apian. I want to thank Louisa for taking the time to speak with me. If you want to learn more about Apian or want to connect with Louisa, check out the webpage at apian.aero. If you like the Drone Radio Show, then please subscribe and share. Write a glowing review on iTunes. And if you're able, donate to keep the podcast going. Go to droneradioshow.com/donate. And thanks for listening. Your support means a lot to me, and I hope you'll listen to more episodes of the Drone Radio Show podcast to hear how others are using drones for business, fun, and research. For the Drone Radio Show, I'm Randy Goers.
This has been the Drone Radio Show podcast. More information on today's show can be found on our website at www.droneradioshow.com. If you're using drone technology for business, fun, or research and would like to share your experience on the show, please visit our website and fill out a guest appearance application. And don't forget to follow us on your favorite social media channels.